Welcome to Evidence Mastery with Dr. Masad Tusi. I am going to help you understand what breast cancer is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice. So let's start with a number that really puts things into perspective. 1 in 8. What does that mean? Well, the evidence shows that for women in the United States, about 1 in 8 will develop invasive breast cancer during her lifetime. It's a number that truly underscores why this topic is so important, because it's a disease that touches almost everyone's life in some way. Okay, so here's our roadmap for today. We're going to break this all down into 5 main parts. First, we'll define exactly what breast cancer is. Then we'll look at the key risk factors. After that, we'll get into the different types and how they can spread. Then we'll cover how it's diagnosed and staged. And finally, we'll wrap up with the principles of modern treatment. All right, let's dive right into Section 1. What is breast cancer? Before we can talk about anything else, we need to have a really clear, shared understanding of what we're dealing with. And besides some skin cancers, this is the most common cancer diagnosed in women. So at its very core, breast cancer is what we call an epithelial tumor. That's just a way of saying it starts in the cells that line the tissues of the breast, usually the little tubes or ducts that carry milk. And this isn't a small thing. It's actually the second leading cause of cancer death for women. That fact alone is why a clear, evidence-based understanding is so incredibly crucial. The scale of this is, well, it's pretty staggering. If you look at the estimates from 2023, you're seeing nearly 300,000 new invasive cases in women. That leads to over 43,000 deaths. But look at the column for men. It's something many people don't realize. While it's much, much rarer, men can and do get breast cancer, with about 2,800 new cases expected. Okay, so that brings us to Section 2, Key Risk Factors. Why do some people get breast cancer while others don't? Let's take a look at what the evidence tells us about the factors that can influence a person's risk. Understanding this is absolutely fundamental to prevention and to early detection. So, the evidence points to several major risk factors. First up, and probably the biggest one, is simply age. The risk just goes up as we get older. Then there's family history. This is huge. If your mother, sister, or daughter has had breast cancer, your own risk roughly doubles. And of course, that ties into specific inherited gene mutations, which we'll get to in just a second. Now, this chart illustrates something that's really important to understand. When we talk about genetics, we're often thinking about those well-known genes like BRCA1 and BRCA2. But look, they only account for about 5 to 10% of all breast cancers. The vast majority, 90 to 95%, are what we call sporadic. That means they're not caused by a single high-risk gene you inherit, but rather a complex mix of genetics, environment, lifestyle, and frankly, chance that happens over a lifetime. And beyond those major factors, the evidence shows us there are other contributors to consider. Things like having dense breast tissue, which is something a radiologist sees on a mammogram, or having had radiation to the chest at a young age. And then there are lifestyle factors, like postmenopausal obesity and alcohol use, which also play a role. Okay, Section 3. We've talked about the why. Now let's get into the what and the how. In this section, we're going to explore the different types of breast cancer and, crucially, how they can behave and spread in the body. One of the most fundamental distinctions we make is between in situ and invasive cancer. Think of it this way. In situ means in its original place. The cancer cells are there, but they're contained, almost like they're inside a capsule. With invasive cancer, those cells have broken out of that capsule. They've breached the wall. And once they've done that, they have the potential to travel. So digging a bit deeper, we see a few key subtypes. The most common non-invasive type is called DCIS, or ductal carcinoma in situ. The cells are just in the milk duct. But then you have something on the completely opposite end of the spectrum, like inflammatory breast cancer. It's rare, but it's very aggressive because the cancer cells actually block the lymph channels in the skin, which is what causes that classic red, swollen look. Now, this slide is absolutely crucial to understanding how we treat breast cancer today. We analyze tumors to see if they have 3 specific receptors. Think of them as docking stations on the outside of the cancer cell for hormones, like estrogen and progesterone, or for a protein called HER2. And this isn't just an academic exercise. Figuring out which of these receptors a cancer has is the entire foundation for choosing a targeted treatment. It's a real game changer. So when we say an invasive cancer can spread, what does that actually mean? Well, the process is called metastasis. Cancer cells can break off from the main tumor and essentially catch a ride through the body's highways, the lymphatic system or the bloodstream.
They can then land in distant places and start to grow new tumors. The most common landing spots are the bones, lungs, liver, and brain.
All right, Section 4, Diagnosis and Staging. So, a problem has been detected. What happens next? This is the process of getting a definitive answer and then figuring out exactly how far the disease has progressed. This step, called staging, is everything. It's like creating the map before you plan the journey of treatment.
The path to a diagnosis is pretty standard. It starts with step 1, detection. That's usually an abnormal finding on a mammogram or maybe an ultrasound. But you can't be sure from a picture, so step 2 is a biopsy, where a doctor takes a tiny sample of the tissue. And finally, step 3, that tissue goes to a pathologist who looks at it under a microscope to confirm if it's cancer and, if so, what kind it is.
Once cancer is confirmed, you'll hear doctors talk about staging, and they almost always use the TNM system. It sounds complicated, but it's really just 3 simple questions. T is for tumor. How big is it? N is for nodes. Has the cancer spread to any nearby lymph nodes? And M is for metastasis. Has it spread to distant parts of the body? The answers to those 3 questions give us the cancer's stage. Which brings us to our final section, modern treatment. Once you have a diagnosis and a stage, how do you fight it? The strategy is really twofold. You have local control, which is about dealing with the cancer in the breast itself, and then you have systemic control, which is about treating the entire body to reduce the risk of it ever coming back. For local control, the foundation is almost always surgery. There are 2 main paths: breast-conserving surgery, often called the lumpectomy, where just the tumor is removed, and mastectomy, where the entire breast is removed. Now, what's so important here, and the evidence from huge clinical trials is very clear, is that for most invasive cancers, a lumpectomy followed by radiation gives you the exact same long-term survival as a mastectomy. Now, for systemic therapy, remember those receptors we talked about? This is where they come back into play. The choice of treatment is totally guided by the tumor's biology. If it has hormone receptors, we can use hormone therapy to block them. If it has that HER2 protein, we have amazing drugs that target it directly. And then there's chemotherapy, which is often used for cancers that don't have any of those 3 receptors. This chart, this really says it all. It shows why staging, and more importantly, early detection, is so incredibly critical. Look at this. For localized cancer, found only in the breast, the 5-year survival rate is 99%, an amazing number. But if it spreads to regional lymph nodes, that drops to 86%. And if it spreads to distant parts of the body, it falls all the way to 29%. That's the power of finding it early. So while stage is the big picture number, there are a few other key factors that help predict a cancer's behavior. We look at nodal status. Are the lymph nodes involved? The tumor's grade. How aggressive do the cells look under a microscope? Its size, of course, and, as we've discussed, its receptor status. All these pieces come together to form the complete picture. And all of this leads us to a final thought about the future. We're in an incredible era of discovery, especially in genetics. And so the big question we're all working on is this. As we get better and better at understanding the unique fingerprint of each tumor, how are we going to combine all our tools, surgery, radiation, and these incredibly smart, targeted drugs to create truly personalized care for every single patient? I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel